Okay, we are talking about stroke today. I want to look at the strategies that helps you prevent stroke from happening to you in the future. Probably things to do to help prevent stroke. So today we are going to talk about stroke, what causes stroke, and how to avoid it. Firstly, we are going to look at some of the things that causes stroke, and which will give you an idea of how you're going to prevent this in the future. I've known that prevention is always better than cure, just like in football when they said attacking is more than defense. So we are going to look at how can we prevent stroke from happening. Mind the stroke is a bad thing, can disfigure your face, can disfigure your body, can make some renders of can render some of your organs inactive. But how can we prevent this one from happening in the future? Um, Before we go to in-depth analysis of all this, let's look at the word stroke itself. Stroke is one of the major cause of death in the part of the world and which has been seen as a serious disease that prevents um, that occur due to due to faults from the brain. I often refer to it as a disease of the brain because it causes partial of total collapse of some part of the body which starts from the brain. And stroke also it disables some part of the body temporarily or permanently. And so if you look at the stroke is a disease that attacks the brain, which occurs when the blood flowing through the brain suddenly stops due to blockage of the blood flow. And many cells, including the blood cells, the brain cells, all begins to die due to lack of oxygen. And that's one of. And if you look at the types of stroke, there are two different types of stroke. That's ischemic stroke and the Heamorhic stroke. If I take a careful look at both and I look that they have something similar. And if you don't know some of these things, then we are not learning. So let's look at the ischemic stroke. This type of stroke caused by a blood clot like a blood clot that blocks a vessels around the brain, and the hemorrhagic stroke is caused by a blood vessel that breaks and flows into the human brain. These are two types of stroke, and let's quickly take a look at how severe or some of the symptoms of all the stroke. The heart beats faster, it increases body temperature, probably before happening it, but after happening it causes trouble speaking, sudden headache, trouble walking, loss of balance, and loss of memory. So looking at the types of stroke and the symptoms of stroke, then I think we can now see that we can now go to some of the things that causes stroke and the strategies which we are going to use to prevent this. Many years ago, an uncle of mine had stroke, and oftentimes I will ask him, "What are those things you feel before the very first minute? Before somebody can just go down suddenly unconsciously, because it happens. It can be anywhere. It can be in the bedroom. It can be outside. It can be as long as something happens to your body and you fall, and the person can just go down. And so we also need to look at this. In our next, we are going to look at hypertension, but today we want to look at stroke. So let's look at some of the signs and symptoms that happened probably few minutes before that time, or what have been happening to you before you can have stroke. So your ability to do away with all these things, or to treat all these things, or to explain to your doctor about all these things makes you, gives you a good strategy so that you can prevent stroke from happening to you in the future. I've always believed that it's only people that are older people have, which is all also common. But these days, I've seen people around age 40, late 30s, early 50s having stroke. So if you want to prevent this and you need a strategy, then we have to look at those strategy one after the other. The first strategy, which is you need to look at, monitor or treat high blood pressure. If you have high pressure, it is likely you can be attacked by stroke because high blood pressure results to stroke. And what you can do is to visit your doctor, get some drugs or caution or treatment or therapy, and just manage it, or you avoid getting stroke. And if you have this high blood pressure, then you need to keep checking. You need to checking your blood pressure day in, day out, probably, and let your doctor know some of those things happening. If you are on drugs, if you are on therapy, if you are on medication, then the better for you. If you monitor your high blood pressure, you not have the stroke. I bet you, because everything is being monitored, and that is one of the things. But many people have this nonchalant attitude of not checking their blood pressure, and which is bad. And so we need to do that. And if you have high blood pressure, then you also look at if on a severe case like hypertension. So if you have hypertension, continue to use your drugs, your medication, let the doctor know about it. And for people who just clock 40 or 50 and they are celebrating, I think this is not the time for you to celebrate. This is time for you to go see a doctor, go to the hospital and run a proper check on yourself. If you have high blood pressure or hypertension, then it causes it. Then the other one that causes stroke to people is smoking. The government said even health professionals said smokers are liable to die young, which stroke also contributes. So if you are currently smoking and you're probably young or older, then you are at risk of having stroke in the future. So another way to prevent it, you must take a strategy of stop smoking at this time. Please stop smoking to avoid getting stroke at any time of your age because it's one of the things that causes it. Because as you are inhaling smoke, then some of those the smoke also find, in one way or the other enters the brain and it may collapse the brain. And when something disrupts the brain, then the stroke is coming. So if you need a strategy to help prevent smoke or happen to you in the future or later in the year, you need to just stop smoking. And the next one is what? Excessive salt, consumption of salt. That is adding more salt to food is as deadly as anything because the common salt, that's NaCl, which contains sodium ion, excess causes heart disease when it's more coming too much. It disrupts the heart, the pressure of the heart. So one thing you need to do, and one strategy you need to have to employ is to prevent you having smoke is to avoid too much of salt at a particular age. Some people, not all, but if you meet your doctor and your doctor asks you to stop continue eating salt, which is not so common. So I think that so at a particular year, at a particular age, at a particular time, you need to stop taking excessive consumption of salt. Yeah, that's my uncle that had stroke the other time. I noticed that anytime at age 50 plus, he will just come home and he continue thinking, this soup doesn't contain too much salt. He will add, it's more, he continue adding salt and then adding salt to his food, not knowing that the salt itself is adding pressure to the heart and which one of those things that causes stroke. And next to this is sugar also. If you love to consume excess sugar at your age through soft drinks or through sugary foods and you're a mature adult, then if you don't have diabetes and you're happy that you don't have diabetes, then you need to walk to your doctor and so that you can manage it because excessive sugar or diabetes increase the chance of you having smoke or having stroke. You understand? Because someone said because I don't have diabetes, because I don't have sugar problem in my body, then I need to just continue taking sugar. No, it is not so. It's only children that can take too much of sugar and nothing will happen to them. But as an older adult, as an older matured man or woman, then you also need to control your excess of sugar. This will also help you in your controlling of or preventing diabetes because diabetes, stroke, and all diseases, high blood pressure, they work hand in hand. So I will suggest you go low on sugar or sugar-related foods, such as soft drinks and others. And in addition, I'm going to add that you should also avoid or go low on beer and alcohol because the end product of beer and alcohol is sugar. And since we are talking about sugar, sugar, sugar here, and you don't like okay, people that had stroke don't know they have stroke. They can be attacked by this disease. It will just happen one day and you just fall and this and that. But you can avoid it by going low on sugar, which is also a very good one in a good strategy. And you can also go if you are overweight, then you notice that you are fat around your body, your tummy, or you're on the big size, then you also need to do some things. You got to go for weight loss programs, dieting, exercises, soft exercises, cardio exercises, and just make sure you find ways of reducing this. If you don't try to work on your weight, then you are exposing yourself to stroke. Because it's like this uncle of mine that asked that I said he had stroke some times ago. I noticed that if he's overweight and he goes to work, he's probably not stressed and he doesn't stress himself. But one day he just fall in the bedroom and he was checked and they told that the it was stroke. He had stroke. So all those things you need to do away. So if you have a strategy of preventing stroke from occurring to you in later part of your life, then you have to work on your weight. You have to make sure you have had moderate weight. Ensure you are not overweight, and all this can be done by eating less of fatty foods, by exercising your body, by going on exercising, or just simple exercises and all those things. Usually cardio exercise probably 1 or 2 times in a week. It will go a long way in helping you to get rid of this. And I'm very sure. Then the other one is to avoid stress. Stressful activities, you're putting pressure on your body, you're putting pressure on your brain. Avoid overnight work, working too late at night at your age. So learn to reduce stress. Learn to make sure that all your work are being done moderately and you have time to rest, you have time to sleep. So if you don't stress yourself, stress is one of the things that causes stroke. And I think I've researched and I've seen people who don't know that they are actually overstressing themselves and they have stroke. A young man has stroke in my area, and I know he works so hard. Working so hard is not the same thing as working smartly. So if you work smartly, then you don't need to have maybe like skipping sleep and all those things. You need to sleep very well so that your brain can rest, because stroke is a disease of your brain. You need to sleep very well, you need to take care of yourself, and that's all. Lastly, I'm going to talk about this, and maybe like you avoid to eating too much of fatty foods. Fatty foods are foods that are prepared by animal fat. So, and they cause cholesterol. They cause accumulation of cholesterol in the body. For young people, cholesterol gives energy. For older people, it causes blockage of blood vessels. So if you're accumulating too many oils, too many cholesterol, too many fats in your body, then in one way or the other, there might be blockage. There might be blockage of signal between the brain, blood flowing through the heart, and before you know it, it can result to stroke. So if you know that you don't want stroke in your life at a particular life part of your life, then at a particular time, at a particular age, avoid to eating too much of fatty foods, processed foods, and all those anything that contain fat. Then just eat moderate and go more on vegetables. Take more on vegetables related food. Take more on fruits and fibers. Then drink more water instead of taking. So I'm going to give you a bonus. These tips, like I love to eat fruits instead of taking alcohol. And if you know that you really want to, maybe like just limit it, and it will work for you. So replace alcohol with fruits. If you feel like taking alcohol, if you feel like getting high, if you feel like taking beer, and why won't go on fruits? You can take as many fruit as possible. Go on fiber fruits, and it will help you. These are the signs, the things, and the strategy which you need to. So if you know you have a strategy to help you prevent slow stroke, then look at all these things we have mentioned. Then it will help you out. I think that is that. Work on some of these things. Prevent yourself from being overweight. Reduce your sugar intake. Reduce your salt intake. Stop smoking. Stop taking beer. Stop taking sugary drinks. Then check your high blood pressure. Then work on your hypertension. Treat your hypertension medically, and do more of exercise. Exercise your body. I've noticed that people who exercise are healthy people. Exercise people that jogs every morning, probably 3 or 4 times a week, or people that take care of that have these physical activities in nature, they usually fall sick. And so I think that's a strategy. And even if you are guilty of some of these things, salt, sugar, and food, anything, but let exercise be your watchword. Let it be your habit. If you make exercise your habit, so I think the strategy is just you need to exercise more. Okay, I think we have come to the end of this, and you can also give us some other strategies which have also worked for you using the comment box below. Thank you. See you in our most. Don't forget to subscribe to our post so you can get health related topics directly at your home page. Thank you. See you in our next video.